Um, Miss Yanes, can we start with you? I know you're sleepy, um, but you're the first on my list. That's the reason I put you guys in backwards this time, uh, alphabetically speaking. Anyway, you were going to talk to us, Miss Yanes, about Alzheimer's disease. Tell us a little bit about it, and we'll discuss if massage relates to it at all. By the way, it may not. Yeah, I mean, some of that's up for debate, by the way, but that's yeah. But anyway, but we will have clients that have Alzheimer's disease, so it's just good to know about. That's kind of why we're doing this. So yeah, tell us, what is it?
So Alzheimer's disease is a progressive neurodegenerative disease, and it creates mental deterioration. It affects a person's ability to communicate as well as their thinking and their memory. It's a form of dementia, and the symptoms usually begin in later middle life, and then they continue to get worse. Um, Massage is actually great for people with AD. It shows that it has a decrease in behaviors such as pacing, wandering, resistance, and their aggressiveness, because people tend to be aggressive. But one thing you do have to be aware of is you're going to have to adjust your massage as the disease goes on, just because they become more easily agitated and confused. And they won't remember you. So it'll kind of be like a new introduction as they get further along.
Wow, that was very succinct. I like that. I really do. Um, so, what do I want to say? Just to kind of recap what you said. Um, so, Alzheimer's disease is a deterioration of your mind, unfortunately, right? Um, and that can cause memory problems. The aggression, they think, comes from the fact that these individuals get very confused. They're confused about where they are, what's going on, and that makes you distrustful and angry. That would be very normal. And massage actually seems to be very helpful because Alzheimer's patients do lots of repetitive behavior. They get very keyed up and nervous, right? They're kind of in the sympathetic nervous mode. And they're repeating behaviors because they're keyed up over and over again. And the stimulus for massage tends to put them in the parasympathetic nervous system mode, and they tend to calm down and have less of these behavioral problems. And so it can be very relaxing to them and very reassuring to them, and it gives their nervous system some really healthy stimulus in the right way. If you have somebody that's got kind of an extreme situation, usually a family member stays with them in case they kind of forget where they are and all that kind of stuff. Yeah. Any questions about that? That was perfect, by the way. Any questions about that? Cool. A lot of the studies, by the way, show that, for one thing, they show that there's no perfect way to avoid getting Alzheimer's disease, unfortunately. But people that engage in physical activities that also utilize their mind, it tends to be kind of preventative for Alzheimer's disease. So things where you have to learn new behaviors and things like that that stimulate your brain, and you're also physically doing them. So like learning to dance or something like that is supposed to be very good for preventing that sort of disease. Okay, Miss Torres. Miss Torres, you are going to tell us about attention deficit hyperactivity disorder.
Okay, so it is a chronic neurologic disorder, and it often begins in the childhood and can persist into adulthood. Um, some of the symptoms include attention difficulty, hyperactivity, sorry, I can't say those words, and impulsiveness.
Yeah.
It also comes with some aggression, irritability, and difficulty focusing, forgiveness, problems paying attention, and some of the moods include like anger, anxiety, boredom, excitement, or mood swings. They do actually recommend massage, like something light, just to relax, but it could be challenging because they don't want to sit in one place. They don't want to stay in one place. So just maybe like adapt the length of the massage, like, but it's gonna be hard for somebody to just sit and relax
Yeah, well
for the
said.
massage.
Yeah, well said. You may have clients with this disorder that you don't even know have this disorder too. They definitely don't have to worry about massaging them. This is a very controversial diagnosis these days. Some people are a firm believer that it just hasn't been diagnosed in a long time. Other people believe that this is a diagnosis of fairly common human behavior that shows up in our modern society. So what I mean by that is most kids have problems paying attention, and most kids are hyperactive at times, and things like that. By the way, I'm not saying this isn't true. I'm just saying this is the counter argument to this. And we live in a society now where we send you off to school and you have to sit down for hours and hours a day, or do what you guys are doing right now, pay attention and stare at the screen. And that's very hard for some people. So some people argue that attention deficit disorder is just a different type of personality, and they just don't do as well in the modern world. And if they lived on a farm, it'd be fine, that kind of thing too. So, but anyway, it is characterized by this kind of hyperactivity and this problem calming down, and sometimes massage can help that. Absolutely. Well done. Thank you. Any questions about that? Thoughts? No. Okay, cool. Miss Stanley, autism.
Autism is a condition that is present more in early childhood. You more or less kind of figure it out when the child turns the ages of 2 to 3. And the levels of functioning can be rated from mild to moderate to severe. And so what autism also does, it's characterized by difficulty communicating and forming relationships. It can be really difficult. And about 1 in every 68 children get autism, or diagnosed with it, I mean.
Good point.
And it's more common in males than females.
Mm-hmm. Yeah.
Which I actually found that interesting. I didn't know that.
Yeah, it is.
And so for massaging them when they're newer clients, you want to ask them questions like what their intolerances are. Some are more sensitive to touch, some can be sensitive to smell, and what else? There's sounds. Sounds can be a big one.
Yeah.
And so sometimes when they're newer, shorter sessions might be more advisable.
Well
so
said.
It doesn't scare them and overwhelm them. You got to give them a chance to kind of get used to it and start understanding.
Yeah.
But long term, if they keep coming back, massage can be actually very good for them and the family, because it can be a way for parents to actually start bonding with their child if you teach them how to do some of it, because the connection, the touch, kind of helps them create a new a language kind of.
Yeah.
It's really cool.
Very cool. Well said. It's actually hard to talk about autism because it's not that widely understood. When you hear people talk about autism, they don't usually say anymore like this person has autism. They say they land on the spectrum. And they say that because there is a spectrum of autism. You can show really strong signs of autism or very mild signs of autism. And those signs tend to be kind of being disconnected from other people. So it is not a mental deficiency. Many people with autism are quite bright. They're just not as socially aware as other people, or don't choose to be socially aware. I don't blame them. So there's a big movement in the autism world right now to not look at this as a disorder, and I would agree with this, and just look at it as some people are this way. Some people are hypersocial, some people are not. But anyway, some of the signs you'll see when somebody is on the spectrum somewhere is they tend to not make eye contact. And I realize we all don't make eye contact sometimes, but I meant they tend to not even be aware they're not making eye contact. They just have a kind of a hard time kind of connecting, and they often don't like touch. And they have a very hard time reading emotions on people. So, which makes it hard for them to connect because they have a hard time reading your facial expressions, whereas most of you probably instantly know when somebody's upset or sad or things like that. Anyway, yeah, there's no massage concerns. I think Miss Stanley said it really, really well. You're just kind of feeling your way through and seeing what they like and what they don't like. You probably won't get somebody with severe autism. All the people I've known with severe autism don't really like being touched a lot. We will actually watch a video eventually of a very famous person with autism who's fascinating, who I think will give you a different perspective on this whole thing. Anyway, any questions about autism? Thoughts? No? No? Cool. Miss Petrie, Bell palsy.
Okay, Bell palsy. Bell palsy is a neurologic condition of the facial nerve.
Yeah.
It's a condition that causes a temporary weakness or paralyzes of the muscles in the face, usually on one side.
Yeah.
It can occur when the nerve that controls your facial muscles become inflamed, swollen, or compressed. The condition causes one side of your face to become stiff or even droop, which would make me think of like a stroke.
Yeah. It can be mistaken for a
It
stroke.
looks like it's
Yeah.
just a stroke on the because it only happens to the face, but it looks.
Yeah.
It can look that bad.
Yeah. Oh, yeah.
So, and they don't know why it happens. Like there's no known like
No,
reason.
you're right. They don't.
For it. I read in the book though that I just read because I haven't been reading any of it in the book. Decided to do my own little research, but
I like that.
found it interesting. It says that it does flare up mostly for viral infections, or often implicated for like the reason why people might get it. Usually herpes simplex.
Yeah.
It usually happens between the ages of 20 to 60. Approximately 2 in 10,000 people in the United States can usually. That's as small as such a small group.
Yeah.
People. It does say the massage does help though. It's also not permanent. It can be, but that's a very rare case.
Usually goes away. Yeah.
Yeah, usually it goes away. I mean, it's there for 2 weeks to like a 6-month period, but massage does help with massaging areas of the face. I read in some areas that you should use harder pressure, and some areas said, no, don't do that, use lighter pressure. So there's this up in the air conversation.
We'll talk about it.
From both sides. I
Good.
guess you would say.
Yeah.
Yeah. Anything else you would like to know?
No, that was actually really good. I know it's hard talking. Oh, go ahead.
People get full recovery when they do recover. They don't lose anything.
Right.
They actually have medications that can help to go along with massaging until you can help get the swollen down and the inflammation so their bones can fit nicer because they get so uncomfortable. The structure does.
Yeah. Well said, by the way. I realize this stuff is hard to talk about because it may not relate to massage at all, really. I mean, massage probably helps the situation, but they think a lot of Bell's palsy cases, as you said, have to do with a virus, actually. You guys remember when we did shingles?
Yeah.
Shingles was chicken pox. Chicken pox is a herpes virus too, so is shingles. They're all this herpes simplex virus, and the virus likes to live in your nerves. And so when it flares up, it can cause nerve problems. And we think some Bell palsy is from that. And when it flares up, it kind of kills the nerve for a while or shuts it down. And you don't realize how much of your face you're unconsciously giving tone to, and it will droop. I think one of the big concerns is, and by the way, the difference between that and a stroke, when somebody has a stroke, quite often their face is drooping too, but they usually have problems moving this whole side of their body if this side of their face is messed up, right? So this person doesn't have any problem with any of this. They just have a droopy face over here. It is quite noticeable. And so I honestly think the concern with the massage is not judging a book by its cover and trying to treat this person like a normal person, because they are a normal person, you know? And people do things by mistake. We all do. So somebody comes in with a droopy face and you start talking to them really loud. Like maybe they're going to have a hard time understanding you or something. Just talk to them like a regular person. I think one of the big tricks that massage therapists have to do, and we have to do in polite society quite often, is not show a facial expression when we see something slightly unusual, right? We just go, oh, hi, you know. When it comes to pressure, you're right. There's two schools out there, deep or light. I wouldn't worry about that. Whatever they can take on the side they can feel, they can take on the side they can't feel. You know, and if they enjoy it, I think it's all fine, everything you're doing. So, well said. Thank you. Any questions about that?
Yes, I have a question.
Please.
So, does it go away? Like, does the muscles come back to
Yeah.
how they were, or is it like a long?
Yeah. No, they don't. The muscles don't seem to atrophy that bad. If they do, they come back quickly. This is a nerve problem, so the muscles are fine. They're just not getting nerve firing anymore. Because a muscle does not contract unless a nerve tells it to. And this is a problem with the telephone line. And once the line's back up, the muscles are still there. They come back online.
Oh, okay.
Yeah.
I had a friend that happened to her, and she's a doctor. She's actually a doctor, and so we were talking about it, and they think it's related with stress. Like she was going through some big thing, and so I asked her like how did it happen, and she said, well, yeah, they don't know, but some studies had showed that it is related to stress, and she was going through like really stressful period in her life, so maybe it is.
Ms. Torres, actually, I 100% agree. I've read those studies too. I 100% agree. But let me clarify for everybody, because this ties into the nervous system exactly, and into massage therapy, and into parasympathetic and sympathetic states. 100%. For many people, the virus is already present. Like I have chickenpox in my body right now. It's living in my nerves right now. It's there. It will be there till the day I die. My body keeps it under control if I'm in the parasympathetic state enough, because it keeps all that stuff under control. It's not a problem at all. If I get stressed and I'm always in fight or flight, I'm not internally keeping that stuff at bay. And what happens is it can resurface. In my case, I can get shingles again. In somebody else's case, they might get Bell palsy. So it is stress related, but it's stress related because when you're in a constant state of stress, your body's not able to deal with the internal stuff it's supposed to be dealing with all the time. It's a perfect example of what we're talking about. It's a perfect example of how massage can actually help people. It can help people never get Bell palsy in the first place by getting them into the parasympathetic state. So thank you for bringing that up. I'm going to talk about carpal tunnel at the end here. Let's continue on. Double crush syndrome, Miss Nguyen. What is double crush syndrome?
Double crush syndrome and contributing factor and metabolic and mean blood flow to nerve. Autoimmune disease in the injury.
Oh, okay.
Because in the compression, pressure on the nerve.
Puts pressure on the nerves, right? Yeah. I'll sum this up in a second. That's good. There's not a lot to say about it. Go ahead.
Example is if the person have in the compression of the nerve, I mean in the edition.
Addition.
I mean in the
I mean, I think I know what you're saying, but I don't know what word you're using right here.
It in the may so impair the function.
Yes, it does impair your function. Absolutely.
Yeah, in the tissue.
Yeah. Yeah.
In this reason. I mean, if you pen here, you pen here, and so you show pen here,
Right.
pen here. I mean, in the nerve in the long. If you pen back, you can in the run on the foot. I mean that. I mean the nerve in the long.
I think I understand.
Yeah, and in condition reason of the never.
Yes.
Never.
Yeah.
Why? Because blockage in the acropolis.
I don't know that word.
I think in the actual pyramid in the follow. I stand for you.
Okay. Double crush constraining factor, metabolic, blood flow to nerves. Yeah. Can I summarize what you just said?
Yeah, but I stand already.
Good. All right. So, everybody, what Miss Nguyen is talking about is probably the most important thing that we'll discuss from what any of you are reporting on today, which is why I gave it to you, Miss Nguyen. It's super.
I can talk very little, but
No, you did good. You did good, really. So,
Yeah.
I want you guys to be thinking about double crush syndrome every time you're working on somebody. Let me explain really simply what it is. If I pick up my phone and I try to call one of you right now and you don't get the call, it could be because my phone's not working, right?
Yeah.
It could be because your phone's not working. It could be because the cell tower by me is down. And it could be because the cell tower by you is down. Your nervous system is very much like a telephone call or a telephone wire. It can be crushed or impinged or pinched, all the same thing, in two areas.
Yeah.
So, like your brachial plexus, I keep using this example because it's super common. It really happens a lot. Your brachial plexus comes out, which is a nerve, a big nerve because it feeds your whole arm, comes out of the side of your neck, runs down underneath your pec minor, runs down by your elbow, runs down by your hand. You could be getting pain in your hand or numbness in your hand, no telephone call in your hand, and I don't know if that's because your phone, your hand, has a problem or because the cell tower is down here, the nerve is pinched here. The cell tower is down here, the nerve is pinched here. The cell tower is down here, it's pinched here. And quite often, by the way, everybody thinks, well, I've got to find this one place. It might be all three, which is triple crush syndrome. But anyway, the point is a nerve can be pinched in more than one area, and it's not uncommon because when I have tension here, I probably have tension here, and I probably have tension here, and those spots could all be pinching on that nerve. So it's very common when we're working on a problem to try to work this nerve back up here to make sure it's not pinched anywhere along the way. So very simply put, double crush syndrome just means the nerve is pinched or compressed or crushed in two areas. That's it.
Yeah.
But as a massage therapist, I want you to be aware of it because remember, again, the problem could be where you're actually feeling the pain, and the problem could be anywhere along the telephone wire that delivers that pain. Right?
Yeah.
So when I have somebody with, I'm oversimplifying, but not much. When I have somebody with a hand problem, I work their hand, but I work their elbow because the nerve can be pinched from their hand there. I work their pec minor and stuff here because it can be pinched there, and I work their scalenes. We haven't learned about those yet, but I work their scalenes that are in the side of their neck. So I hit all those because I don't know what it is. And I won't even know when I'm done. The client just gets better, and I'm like, well, it was one of those things, or it was all those things. Could have been all of them. So just be aware of double crush syndrome because I want you to be aware that nerves can be pinched in more than one place. In massage, it's different than surgery. In surgery, we're trying to find the one thing that's wrong and cut it and fix it. You don't want to cut more than you can. Massage is not that way. Massage, we rub everything that could be wrong. We've got nothing to lose.
Yeah. So in the massage the head.
Yeah,
Because
massage
if you-
absolutely helps. I mean, unless it was crushed
Yeah.
because of, yeah,
If you bend here, you massage here better, so here okay.
right,
And so that's why in the nerve it belong.
yeah. But I recommend you don't actually spend your time trying to figure out exactly where it is pinched. You just rub all those spots. I think you'll find it's quicker. But yes, awesome. And massage is perfect for impinged, pinched, double crush syndrome type stuff. I'm trying to use different words you're going to hear. People say I have a pinched nerve. I have an impinged nerve. I have double crush syndrome. That's all pinched nerve to me. So it's all a nerve that's being impinged by something, and we're going to rub and loosen up that something to create space in there. Beautiful. Thank you.
Yeah, thank you, sir.
Miss Monreal, herniated and bulging discs.
Can you hear me?
I can now.
Okay. A herniated disc is, well, going back to the spine, in between the vertebra, there is like a jelly donut type stuff and has fluid in it. And, because of injury or like everyday, bad posture or just things that we do, it gets squished. And it can bulge out in certain, yep, just like that. Certain areas, when it's really bad, the fluid can actually leak out. And when it is squishing, it is putting pressure on the nerves. So people can have shooting pain and weakness to their arms or legs. You can get a bulging disc anywhere, but it is not anywhere, but obviously anywhere along the spine. But it is most common in the lumbar region.
Cool. Cool.
And it's not fun.
Yeah, so by the way, herniated disc and bulging disc in my world are the same thing. You'll hear people use them
Right.
interchangeably. They'll also say stuff like blown disc. I blew a disc. They mean bulging disc or herniated disc. Somehow the disc is squished out.
Also.
Slip disc too. And by the way, slip disc makes you think this disc slipped out. It cannot slip out. There's never been a case of that in the world. But what they mean is a piece squished out, and they call it slipped disc. So slipped disc, herniated disc, bulging disc, all that stuff is the blown disc is the same thing. And what we're worried about is this disc has pushed out and it's hitting one of the nerve plexes usually. Sometimes it can hit the spine directly. Either way, these nerve plexes aren't one nerve coming out of here. They're a branch of a million nerves coming out here to feed a big area of your body. So lucky you if you have this happen, your entire leg will hurt. Your entire arm will hurt, but usually they're down low. So because they're down low, it's usually your legs that hurt. You will have a hard time controlling your bowels because your nerves down there feed your bowel control. So it is not pleasant. There are two types of pain in the world that are really not pleasant. Back pain from a herniated disc and teeth pain actually is pretty bad from what people describe. Anyway, is massage good for it?
I mean, it is good, but you just have to be super careful that you are not applying a lot of pressure.
Yeah.
And if the person is uncomfortable laying down, I mean, that's gonna get in the way of that. But if you are gonna perform massage, you just want to make sure that there's like nothing on the table that is making it harder for them to get on, like a bolster or a pillow or anything like that. You want to have the table kind of low so that they don't have to be uncomfortable getting up.
Yeah.
And if they are in a lot of pain, then you just postpone until it's tolerable for them.
You're going to get a lot of clients, everybody, that come to you with this problem. This is a reason people seek massage. So I want to be really, really clear that essentially the massage itself essentially cannot make the problem any worse. I would even argue you can go very deep. That's assuming it doesn't bother them, but you're not going to hit the disc. The stuff I do avoid, Miss Monreal's right. You got to get them in a comfortable position. They might not be able to lay on their back. They might not be able to lay on the stomach. They might want to lay sideline. That's one thing. So you just got to get them comfortable laying there so you can work on them. But you can go to town on this area because the disc is way inside here. You're not going to hit it. You do want to go slow though because you might irritate a nerve while you're going down and it kind of sets them into a spasm. But you don't have to be careful of the sense of pressure wise. Some people with herniated discs like really deep pressure, and that's fine. It'd be like any other client, just check in with them. The stuff I am a little bit careful about with herniated discs is certain types of rotational stretching because sometimes that pinches the disc a little bit more. So be very careful when you're stretching those clients, and be very careful when they get up off the table. Because what happens is on the table, all this stuff kind of spreads apart, and you've done your job and you've pulled the spine apart and they're taller and they're relaxed. And tell them when they get up, their feet need to engage the floor very slowly because when they get up, all of a sudden that happens again. They squish back down again, and that can make their back tighten up. Also, don't be freaked out. They might go into a muscle spasm on your table. They're not going to die. But like they'll be like, because what happens is they get some pain, and then the muscles back there tighten up because that's a natural reaction to pain, and that makes the vertebrae pull closer together, and that makes the thing get pinched more, and that makes them more pain, and then they get more pinched, and it's a pain cycle, we call it. In fact, that's why they're there for massage. You can't make the bulging disc go away, but you can oftentimes stretch out and relax the muscles so there's not as much pressure on the bulging disc. So bulging disc, herniated disc, slip disc, all that stuff. Yes?
Also, just something important to remember if you are working on somebody like this. So again, like Mr. Tapscott said, you know, the spacing in between the vertebrae is what we're trying to achieve, but you want to like avoid like rocking motions or like
Probably.
jostling them.
Yeah.
Like even when we do like bear walks, like that might not be the best thing at that time.
Yeah. Yeah, I actually essentially agree with all that.
There's
Yeah.
already
Yeah, I agree. I don't think it matters if you do stuff deep, but you better do stuff slow. And I don't just mean slow in, I also mean slow out. Because if you come out fast, then things tend to smack back together again, right? So everything is slow. Slow in, slow letting off. I don't care how hard you go, but it's slow in, slow, because what you don't want to do is kind of have stuff like their vertebrae come in and out and rock together and stuff like that rapidly. Yeah, so just slow and powerful, which by the way is a good massage already. Slow and powerful. Yeah? Cool. Any questions? Well done. Thank you. Thank you. Any questions at all? No? Okay.
I have a question.
Yeah.
Well, it's not really a question, but what you said regarding like spasms on the table, like that, I feel like would freak me out. Like, so
It
what
will.
happens? Do you continue the massage if they have a spasm, or like, are they pissed off? Like, what?
Usually none of the above. Usually it goes away really, really fast. It's just they're going to be like, oh, and you just have to kind of let them kind of, give them a second to deal with that. Yeah, I guess if it didn't stop, you'd have to end the session. I guess if it really, really didn't stop, you'd have to call 911 or something, but you're not going to have that problem. I just want to warn you guys that because there's a very sensitive nerve down there, it doesn't take much to put them into a spasm. You don't even have to do anything. They just might get on the table. When somebody comes in with one of these things, they come in like this. So I herniated my disc. They're having a hard time walking, and you can work on them, totally. But like everything they do, they got to be careful. They're trying not to set off the nerve. And so it's very common for them to be like, oh, no, it's okay. Just every once in a while it gets me. They'll do that. Like that's not unusual.
That's crazy.
The good news is it's not life-threatening,
Okay.
right? So, but it
I
is
think
creepy.
I think it's really important at that time, though, for us as therapists to like remain calm. I mean, we don't want to freak out and be like, "Oh my gosh, are you okay?" Because then you're just like solidifying their panic, and
Yep.
they're not gonna like relax enough for their muscles to relax.
Yep.
So like I always like to put my hand on the person and be like, oh my gosh, okay, just let me know as soon as that subsides or something.
Yep, that's all you can do.
Because you want to make them, you want to soothe them
Yeah.
in a sense.
Yep. And let them know that, like, it's okay. Sometimes they're a little embarrassed almost. It's like, man, herniated discs are the worst pain ever. I feel you. Like, let them know you see this all the time. Like, it's normal, to be doing that. Like, that's what happens sometimes. Like, yeah, agreed. And you remain calm but concerned. Yeah. There's nothing you really have to get freaked out about as a massage therapist unless you think somebody's having a problem breathing or having a heart attack. That's when you should freak out and call 911. But everything else, it's really about kind of being like, okay, let's see where this goes, Cool. Any other questions? It is a little freaky. Miss Bolotic, migraine headaches. Tell us about migraines.
Okay, so migraines are intense headaches that can feel as if there's a helmet on your head that keeps getting tighter, or someone pressing needles into your eyes. Migraines are very common. They're more prevalent than diabetes, epilepsy, and asthma combined. It's ranked the most sixth disability. Sorry.
You're fine. Disability?
Illness in the world. Some people get them once or twice a month, and many deal with it every single day. They cause symptoms such as visual disturbance, nausea, vomiting, dizziness, extreme sensitivity to sound, light, touch, and smell, and tingling or numbness in the hands or face. These symptoms can last up to 4 hours or even 3 days. It is most common in women and can occur in children. There is no specific treatment, long-time treatment, other than over-the-counter pain medication or home remedies. If a client does come in with a migraine at the current moment, don't massage them because of how sensitive they are. Until they fully recovered. Recommend home remedies such as menthol-infused products on their head and temple region to reduce pain. Once they recovered, focus a massage on the muscles of the scalp, posterior neck, and shoulders. Massage can improve their sleep quality and reduce the migraines frequency to flare up. Massage can also reduce the person's stress, anxiety, and decrease heart rate, and decrease the future migraines pain intensity.
Yeah, well said. Okay, what Miss Bolotic shared was textbook perfect and correct, and thank you. It's exactly what I asked for. I have a few things that I derivate from the textbook, and this is just my personal opinion, formed by 25 years of doing massage therapy. Now, yeah, migraines are, I've never had one, but my clients who've told me about it, it sounds like a living hell. And they do seem to affect women more than men. I feel like everybody I know who gets migraines is a woman. Anyway, if they want you to work on them and it feels good to them, feel free to. You're not going to make it worse if they want you to. And my experience with migraine sufferers is they want you to work hard on them. They want you to tear this area up back here. And the suboccipitals that we've talked about, they get so much tension right here, they want you to like dig in there. They take more pressure than anybody I've ever worked on because they know what pain is. Anyway, you're trying to loosen up their shoulders and neck and things like that. And massage does not take away a migraine, but it does seem to make them come on less often and be less intense, and that's usually worth it. Yeah, that's that. You probably won't see somebody with an immediate flare-up because they usually don't even leave the house. They're nauseous, they're seeing black spots, all sorts of stuff. But anyway, well said. Any questions on migraines? Definitely work on them if they come to you. You will get, you will get a client who's a regular migraine sufferer who will be a regular client. They're great clients, right? Massage is one, there's not a lot of stuff to do for migraines, and massage is one of the best things they can do. So.
Wait, I have a question.
Yeah.
So I read that you shouldn't work on them, and you say that we should. So should we just ask them?
Yeah. Yeah, that's what I meant. That's why I meant you reported on the exact textbook correct thing to report on, but they're very individual. Migraines are, and if somebody says it feels good, or it takes their mind off the migraine or whatever, go for it. You're not going to hurt them. And if it doesn't feel good, stop. Right? But they're probably there because they know it feels good, and they don't care they're having a flare-up and they want you to work on it. Does that make sense? But you have nothing to worry about. You will not harm them. So if it feels good to them, do it. Do it. Yeah. So books tend to be really cautious, right? Because they don't want to get sued. Yes, Ms. Torres.
I have a question. So do you like? So for somebody that has the migraine problem, I personally think that it has to do a lot with stress, because my mother-in-law suffers from that, and usually it's when she's really stressed out. But it's like, do I give her a massage like once a week thing to prevent it, or it just how do you recommend it to somebody that has a migraine before they get the migraine?
Yeah, thank you. And you're right. We need to be recommending our services to people, right? You need to get kind of good at selling yourself. I always tell people I can't promise anything, but I can tell you research and from experience that people that get regular massage report having their migraines happen less often and being less painful. You might want to try regular massage, right? Then the question, by the way, everybody asks this question with every problem. How often should I get a massage? And there's two answers to that question. One answer is
Every day.
yeah. One answer is that you can massage any, it's like working out. You can massage any area that's not sore from the last time you massaged it, right? So if I beat the heck out of your back and it actually feels sore from being massaged heavily, that's fine, but we don't need to massage it again. We need to let it kind of heal from the massage I did. This is with a very deep massage. The second answer to that question is as often as you can afford it. You can get massage every day. You guys are doing it right now. It's fine. When I do really deep work on people, I can't do that to them every day because it's deep and they're kind of beat up from it. But I've had clients where we did really deep work on their back one day, really deep work on their legs the next day, really deep work on their back one day, and we went on and on and on like that. You can massage somebody all the time. And with migraines, honestly, it'd be great if they came in 3 times a week. That would be great. The reports say that once a week is enough to show, significant help. But 3 times a week, I think everybody should get a massage 3 times a week if they have the time and the money. Right?
So my mom has really bad migraines, and she gets a massage like while it's happening, and she says it makes her feel a lot better. So I don't think that you have to worry about it, because hers is like she can't even get out of bed bad, but she can go get a massage and she'll feel like 10 times better.
Yeah. And I'm assuming she likes a deep massage too.
Yeah.
Yeah.
I mean, she goes to the chiropractor too.
Yeah.
Cool.
Yeah. So everybody's different, and yeah, that's great. And so it helps her even during a flare-up. That's great. Yeah.
Is there a difference between a headache and a migraine?
Yes. A headache hurts, and a migraine is the end of the world.
Okay.
I mean, Miss Bilotic said it, but I've had other people say it. They say it feels like somebody stuck knitting needles into their eyeballs. Whereas a headache is like, oh gosh, headache feels like you bit your tongue, or you smashed your teeth together, or you got, what I mean, this throbbing thing. Right. Migraines literally make people puke.
Right.
The pain is so bad they throw up. The pain is so bad, the pressure is so bad that they can't see sometimes because the nerves are being pinched that hard. Their optic nerves are pinched on. I mean, it's apparently a nightmare.
So for massage, I was told that like there are even like trigger points or some sort of scalp massage that can help, but I don't know if that's for headaches or if that's for migraines. So I think it probably has to do with headaches probably more. Because migraines seem like it's a much more hardcore type thing.
I mean, this is the truth. There's not a lot of research out there on massage, actually, and you guys have to experiment on your clients. So if you get a client with migraine, they'll try anything.
Yeah.
I mean, if I went up to Miss Giannis's mother and said, "Hey, I've got this thing. We're going to try some pressure points on your head," I guarantee she'd say, "You go for it. Do all the other stuff I like, but go for it. Like, you try anything, whatever you think." Because they're willing to, yeah. And you might discover, by the way, something new that helps. I'm not joking. This is not like some pep talk here. Each of you will actually discover something in the massage room that has never really been quite figured out before. It may not be major, but you'll figure out a weird little way to get into a little spot. Or you'll figure out this little thing that seems to help headaches that nobody's kind of come across a little bit. Or you'll figure out a way to kind of deal with plantar fasciitis. Or you'll figure out a little stuff because you're just experimenting every day on people. And there's no danger of experimenting with massage. That's what's nice. So your mistakes, the days that your experiment fails, they still got a massage. Right? The migraine person you tried your pressure points on, they still got their massage. You didn't make it worse. Or if you did.
I just worry about if they are having like this pins and needles, not pins and needles, but the whole like in your eyeballs needles and stuff like that, and then I try to like alleviate it and I just make it worse by touching their head. I don't know. That's why I was like.
What I've been told by migraine sufferers is it's so bad you couldn't make it worse. I've even been told on multiple occasions that they like it when I hurt them in the massage because it takes their mind off the other hurt in their brain. Like,
Okay.
and Miss Giannis is nodding because she's probably heard her mom say this. Like, I mean, it really is. I would never do this, but it's the kind of thing where kick them in the shin. They'll thank you because at least they'll be thinking about their shin for a second. It's you can't make it worse.
Okay.
And if they say it's starting to get worse, then stop. But I just meant like it's not going to be the problem.
Okay.
Yeah. Go.
A girlfriend of mine had just called me up about this and said, do you have a massage table? I said, I do. And she said, can you give me a massage? I'm like throwing up because my migraines are so bad. And I thought about it, and I was like, with all this sickness going around, I really can't chance that because I can't be away from school. So I was like, that's kind of a toss-up. Like, what do you do?
Yeah. Actually, Miss Petrie, I'm kind of glad you said that. I didn't think about that, but that's the decision you guys all have to make as massage therapists, right? I mean, I care about my clients. I really do. I care about people, right? We don't ever want to hurt somebody. But in general, massage is super duper safe. You need to worry about yourself, right? Like Miss Petrie's like, I really care about my friend, but like people vomiting around me is a really good way to spread viruses and stuff, and this is just not a time for me to do that. So yeah, I worry about that kind of stuff more. But it's nice that you guys care. It really is. But migraine sufferers could be 25% of your clientele. So try new stuff. It'll be cool. It'll be great. Thank you, Miss Bolotic. Thank you. Okay. Any other questions about migraines? Good. Enjoy, in a weird way, I want you to enjoy this stuff when a client comes to you this way because nobody knows the exact right answer and you really might figure it out. You'd be shocked what massage therapists figure out. I know because I teach continuing ed and they come back and they're like, oh yeah, I do this thing. And I'm like, I've never seen anybody do that. And they all do this. You will all come up with new stuff. It's really very cool. Miss Cooper. Hi, Miss Cooper. Miss Cooper, multiple sclerosis.
Yes, multiple sclerosis is a freaking monster. It's awful.
Yeah.
It usually starts when, it could happen at any age, but usually 20 to 40 years old. And it is basically when, so they don't exactly know what causes it. It could, I'm gonna explain what it is, but they don't know exactly what causes it. They think it might be genetic, or environmental, but it's an autoimmune disorder. When something goes wrong and your body thinks it has to attack your nerve cells.
That's exactly what it
So
does.
it starts sending out its own antibodies and destroying like the myelin sheaths. And it is really awful to experience. Like I said, it's lifelong, and it's really painful and makes it progressively gets worse. So it could start as like tingling in your body, but then it progresses to like not being able to move at all because it's so painful.
Yeah. Yeah, some very famous people have had this. It's fairly common. Can you massage it?
Yeah, it makes it feel a lot better. It doesn't cure it, but it just helps them feel better.
Yeah. There is basically no concern working on somebody with multiple sclerosis. It seems to help them feel better. There is no cure for this disease. The myelin sheaths here get deteriorated, and the nerve impulses don't flow down them very well. They get deteriorated because the body actually attacks itself during that stuff. Eventually it kills you, because eventually your nerves can't talk to things like your heart and your
Yeah,
lungs.
I mean, they have medication that can slow the progression and help, but there's no like miracle cure
Yes,
for it.
it can be like a 30-year death sentence. But anyway, massage is very helpful. This is another kind of thing where somebody is completely there mentally, but may not physically look like they're there, right? Because they're having a hard time communicating to their body. So their movements might be very unusual. But you have to remember there's just an ordinary person there who is having a very hard time making phone calls to their body, right? But the person who's behind the phone is just fine. It's just the phone system's not working very well. Yeah, any questions about this? Well done.
Thank you.
Okay.
The one that can't talk and communicate, right?
Yeah, so, right, depending on how far it's progressed, eventually they lose motor skills in their mouth. Yeah, eventually swallowing becomes an issue. But in the beginning, they can. And so that is a consideration, by the way, with anybody who can't talk, is a client does need to be able to give you feedback somehow about pressure. Now, people with multiple sclerosis often find ways to communicate. So you have to be like, I need you to make a noise if the pressure is too much, or something. And their caregiver will talk to you too if they're really at that state. But that's my big concern, is anybody who can't communicate, I want to make sure they can communicate about pressure, because the body gives really good feedback, and if it feels good, it is good, and I want to make sure it feels good. Yeah. Is that kind of where you were heading with that, Ms. Hanson? Or just making a comment? Yeah. Just make sure you can talk to anybody, right? And by the way, people that can talk well, we're always trying to make sure they speak up too. It's very hard to get people to speak up. Remember, they're naked on a table, you know, so you're trying to make sure they really, really feel comfortable speaking up. Miss Felix Osuna, you're going to tell us about Parkinson's disease.
Hi, yes, I'm going to be talking about Parkinson's disease. It's a disorder of the central nervous system that prevents tremors. It happens because the certain level damages in the brain, causing dopamine levels to drop, leading to the causes of or the symptoms to Parkinson's disease. It is the most common neurological disorder in older people. Not the younger people do get it too, but it's really rare, so it's not that often. Other symptoms are slow movement, stiffness, and loss of balance. Massaging does improve their daily routine, but and they also get better sleeping as well. The best position to be massaged in while having this would be because you get more access in that area.
Would be what?
The seated position.
And what area are you trying to get access to?
I'm guessing like in the neck and the head. It is chronic. It can be progressive, meaning that the symptoms do worsen over time. That's basically it. Yeah.
Cool. Cool. Yeah, massage is commonly used for this. I was just trying to think what to add to that. Really not much. Massage is commonly used for this, and there are reports that it helps with the symptoms. Yep.
Yeah.
And it's quite safe to do again. Yeah, really quite safe to do.
Mr. Tapscott,
Yeah, talk to me.
I didn't ask. Did you want me to do a list of these pathologies?
Oh, I think we well, your other list was, yeah, we should still do it. Let's do it.
Okay.
You're going to need them now, huh? Well, actually, they're in the book. We'll figure it out.
Yeah.
Okay.
Yeah, but I would like to check with you because sometimes you have a difference of opinion than what the book says as far as whether it's okay.
I'm making up as I go. Yeah, no. Yeah, no, yeah. And last time you sent them to me first, and I read over them.
Okay.
Yeah. So far, I think everything's been like, go ahead and massage it, Okay, cool. Miss Hanson. Miss Hanson's going to talk to us about sciatica, which you will have lots and lots of clients with sciatica. So, take it away.
What? Sciatica is inflammation on the sciatic nerve. It's when you have pain radiating down the sciatic nerve, going down one or both legs, down the lower back, and often comes with numbness. Bulging or herniated discs is the most common cause. Bone spurs on the spine or narrowing of the spine compresses part of the nerves or other causes. The massage needs to be modified according to the cause. If the cause of sciatic is herniated discs, massage may need to be postponed if pain is severe. Clients with sciatica are prone to additional nerve injury at pressure points behind the knee and front of the ankle. For this reason, use soft rather than stiff bolsters in these areas.
Yeah. Sciatica, when somebody says they have sciatica or they're diagnosed with sciatica, it doesn't tell us what caused it. We just know something's irritating the sciatic nerve. So, out of your, hold on, I'm trying to, this is somebody's butt, right? Out of your sacrum, these nerves come down, they kind of run down here, and they feed the whole back side of your leg. I mean, your back of your thigh, back of your leg, bottom of your feet. And they can get pinched here, and it gives you all sorts of aches and pains down your leg, in your butt, all that kind of stuff. Okay? But what Ms. Hanson said was really smart, because we could have a pinching up here that would make us think we had a pinching down here, right? So just remember, this is that same kind of common thing, like, just because my foot hurts, I might have a foot problem. I might have sciatica, and the nerve might be pinched here. It might be pinched up here too. I'd be rubbing all this stuff. Let me give you a better visual. This is looking at the back side of a left leg. Back side of left leg. This is their bun, their left gluteus maximus. If I pull this off, I want to make sure you guys can see this. If I pull this off, you see this yellow thing? That's the sciatic nerve. And it's actually coming out from underneath the sacrum, but through those sacral nerves. And it's running underneath a muscle right here that commonly pinches it, called the piriformis, and we'll learn about that later. You won't go a day as a massage therapist not hearing the word piriformis. Anyway, but that's a common place that it gets pinched. But that's not the only place it could be pinched. It could be pinched up at the spine up here too, right? So, but this is generally people who have sciatica feel kind of a burning in their butt, underneath their gluteus maximus, and they often have achy legs and things like that. Any questions about that?
I do have a question.
Doctor.
So, is that a long-term thing, or is just until you release the muscle?
Oh, well, if it really is just a muscle pinching it and you can release it, it'll go away. But something caused it in the first place, and the stuff that seems to help it is massage and stretching, right? But it could be caused because there's a herniated disc that's pinching on the sciatic nerve, really, before it even forms the sciatic nerve. It could be a lot of things, lifestyle stuff. Inactivity does not seem to help sciatic problems. And most of us have lots of inactivity, and I'm not calling you guys lazy. What I meant is, like, look what I'm making you do right now. You have to sit here for 3 hours. That kind of inactivity is not good too. But yes, Ms. Torres, it does not have to be permanent. It does not have to be permanent at all. There are weird little things that seem to set it off too. Like men who carry their wallets in their back pocket. That pressure on the sciatic nerve over a long period of time seems to irritate it and cause sciatic problems. So they'll tell you if that's where you carry your wallet and that's where it hurts, to not carry your wallet in your back pocket anymore. Because sitting on it presses on the nerve and irritates it over time. Nerves are very much like people. You can bug them a little bit, but after a while it's too much. Right? I can annoy you a little bit and you'll put up with it. And I can keep annoying you a little bit and you'll put up with it. But eventually, you'll snap. Nerves are the same way too. A wallet pressed on your butt should not do anything. And it doesn't. But after 10 years, it does. So it's that kind of thing. Sciatica can come from just some pressure on that for a long period of time, but completely curable. It is not necessarily a long-term thing, although some people suffer with it their whole life. Any other questions? Oh. Okay. Thank you, Miss Hanson, by the way. Yeah. And by the way, massage helps. Stretching, massage, stretch their legs, rub their buns. I don't mean this in a weird way. You should be rubbing everybody's buns if they let you. People love this. You should be putting a fist in there on everybody. Walking down the street, just, yeah, everybody. Clients love it. This is the center of their body. You know, there's a lot of tension underneath here. Yeah. And this area can take a lot of pressure if you do it right. Okay. Seizure disorders. Miss Harper.
Yes, sir. Okay. A seizure is a sudden uncontrolled electrical disturbance in the brain. It can cause changes in your behavior, movements of feelings, and in levels of consciousness. If you have 2 or more seizures or a tendency to have recurrent seizures, you have epilepsy. The nerve cells or the neurons in the brain create, send, and receive electrical impulses, which allow the brain's nerve cells to communicate. Anything that disrupts this communication pathways can lead to a seizure. The most common cause of seizure is epilepsy, but not every person who has seizure has epilepsy.
Right.
Most seizures last from 13 seconds to 2 minutes, but if it lasts longer than 5 minutes, it is a medical emergency.
Yeah.
Seizures are more common than you might think. It can happen after a stroke, a closed head injury, an infection such as meningitis or another illness. Many times, though, the cause of seizure is unknown. So, most seizure disorders can be controlled with medication, but management of seizures can still have a significant impact on your daily life. The good news is you can work with your healthcare professional to balance seizure control and medication side effects. Massage can be beneficial to a person with seizure or epilepsy. Based on the Epilepsy Society, massage promotes well-being and reduces stress for people with epilepsy and can be used alongside any epilepsy medication they are taking. Where seizures are triggered by stress, a massage that helps to reduce stress may, for some people, also help reduce seizures. Massage is often used to reduce tension and pain in muscles and help with poor sleep patterns, which are common among people with epilepsy. If a client has a history of seizure disorders, ask about any known triggers and avoid them during the session. Like contrasting light, dark patterns, and flashing or pattern lights may trigger the seizure in clients who are photosensitive. Ceiling fans may need to be switched off too. Certain odors can be triggered of a seizure. Therefore, aromatherapy may be contraindicated. We can avoid the following essential oils like rosemary, fennel, sage, eucalyptus, hyssop, camphor, and spike lavender. And also, and consider teaching or encouraging the family or the caregivers to administer reflexology to the client at regular intervals. This may help reduce seizures frequency and reduce pain.
Very cool. Thank you. Super duper common. Super duper common for people to have regular seizures, and it's super duper common for you to have one sometime in your life for some reason. So they can be tied to all sorts of things, all sorts of illnesses, high blood pressure, a freak occurrence, and in general, they are not dangerous. So Ms. Harper's exactly right. When they go on longer than 5 minutes, that's a concern, or when they keep repeating. Like when somebody comes out and then goes back in and has another seizure, when they keep repeating, that's when it's a concern. But in general, it is not a concern. In fact, the rule of thumb out there is not to call 911 right away when somebody has a seizure. But if it's been going on longer than 5 minutes, then it's to call 911, or if they seem to keep having it over and over again, to call 911. But in general, they're so common that you don't call 911 when somebody's just having a seizure. Any questions, comments, anything? Yes, Ms. Cooper.
Oh, no. I don't got none.
Okay. And the other thing is, by the way, when your client's having a seizure, stay with them. Right? Stay with them, keep an eye on them, make sure they don't roll off the table. It's a little disturbing to watch sometimes because if you haven't seen it before, but I've had students have seizures in class before. And they tend to feel a little disoriented when they come out. People often feel embarrassed, you know, as we do with everything. So just be reassuring. But you're there to keep an eye on them, make sure they don't roll off the table, and also because you might have to go and make a call if things kind of progress. But 99% of the time, it's just a freak thing that we're not quite sure what happens. And there is some things to suggest that massage, because it's a little stress-related, massage helps make them happen less often.
The only thing that I would be concerned about is somebody swallowing their tongue. Sometimes that it doesn't happen with everybody, but
yeah.
you keep them calm, but to also know that you have to take action of what do I do to not have them swallow the tongue.
Yeah, my stuff that I've always been told is don't do anything with their mouth to avoid that, because it can cause other problems. Do be prepared to roll them on their side if they get sick or something. You wouldn't want them to choke on their own vomit. There's all sorts of stuff. If they're on the floor, you put your knees on both sides of their head to kind of protect any thrashing around and things like that. You're trying to minimize stuff, but in general, you're not doing anything except observing. That's just, I'm no expert on this. That's just what I've been told. I have experienced it a couple of times, like I said, with students, actually, not clients, students in class. And yeah, but feel free to massage, don't massage them while they're having a seizure, but feel free to massage client people with seizures. And you will have some people tell you like, hey, I get seizures, it's unlikely, but I just want to kind of warn you, it's going to be okay. And you're like, cool, thanks for letting me know, because that's kind of nice to have up in my head, right? Now I know that this is normal for you, and we'll just kind of keep an eye on it. Anything else, anybody? No. Okay. Miss Hunter. Miss Hunter, I am excited to hear about thoracic outlet syndrome.
Hi.
Hi.
I was hoping it would work, but it didn't. I wanted to, I'm glad you mentioned scalings in the previous person. I think it was Double Crush. Because I'm going to mention scalings.
Yes,
Hold
you are.
on.
You did your homework. Good.
Sorry.
Don't be sorry. You're fine.
Okay. So I'm going to attempt to show this. So basically thoracic outlet syndrome. Do you see the screen?
Yes, we do. Thank you for the slide presentation. Yeah, you
I
did.
figured it out finally. Gosh. All right. Hopefully nothing embarrassing pops up on my phone. Anyway,
That would be awesome.
Everyone just ignore it. What thoracic outlet syndrome outlet is the ring formed by the top ribs just below the collarbone, as seen in the photo. Thoracic outlet syndrome occurs when nerves or blood vessels are compressed by the rib, collarbone, or neck muscles at the top of the outlet. It's a neurovascular compression injury characterized by tingling, numbing, and pain in the shoulder and upper extremities, hands, and fingers. Thoracic outlet syndrome can be caused by sudden trauma. It's more often caused by repetitive actions and postures. It can also be brought on by having an extra rib above the first rib. I guess people are born with this sometimes. So yeah, that could also, but that's the general area of the issues. There's actually 3 types. I don't think the book mentions it. But yeah, there are 3 types of thoracic outlet syndrome. But I think we, for the most part, are about 2. I can explain them or not. I don't know. What do you think, sir?
Please explain them, because I didn't know there was 3 types.
Okay. The neurogenic TOS, thoracic outlet syndrome is abbreviated TOS, occurs when the nerves leading from the neck to the arm, the brachial plexus, is compressed. More than 90% of cases are neurogenic. So this is the most common one as massage therapists we probably will probably have to deal with. Venous or venous, it's not vein, it's venous TOS occurs when a vein is compressed.
Oh, okay. I understand what they mean by
yeah.
3 types now. Okay.
Yeah, leading to upper body thrombosis. 5% of cases are this. And then the third one is arterial. Arterial TOS occurs when the artery is compressed, and only about 1% of this. I do believe in my research that massage can help all 3, but again, you can, massage can help. The compression caused by the scalings can be decreased by relieving those muscles of tension through direct massage. If the compression is costoclavicular, which I saw in this, I was like, costoclavicular, I'm assuming it's off the coast of the clavicle.
Costal clavicular means between the clavicle and the rib. Costal.
Oh, coastal rib. Yes.
Right.
Yes,
So the
yes.
clavicle kind of pinches it down on top of the first rib.
All right. Thank you. If the compression is costoclavicular, massage can also help to increase the space between the collarbone and the first rib. Stretching and range of motion can also help with mild cases of TOS. I'm assuming if it's a heart or like a crazy case, like probably maybe not stretching or maybe not range of motion exercises. I don't know. Yeah, so that's what I learned on it.
It's fantastic.
Hope picture helps.
Fantastic. Fantastic. Okay. So let me summarize a little bit of that, because it was very well done, by the way. Because you will have clients come to you with this. So remember, we have nerve plexes. So this is really important. Nerve plexes are just fancy words for branches off the trunk of the spine. If the spine was a tree that's inside these bones here, you can't see it, but we know there's a big, thick yellow thing there. There are thinner branches that come off the sides. These are not individual nerves. These are millions of nerves wired together. They're going to feed out through your body. Well, up here in your neck, right up in here, a couple of these nerve plexes come out. They wind together, and they make the brachial plexus. And it's the nerve branch that feeds my entire arm. As they go down my arm, they spread out, right? And get to every little fingertip stuff. Right here at my neck, they come out between my scalenes. You've got these three muscles on the side of your neck that we're going to learn about called the scalenes. There's three, and they're kind of on the side here. So the one in front is called the anterior scalene. The one in back is called the posterior scalene. The one in the middle is called the middle scalene. And the nerve plexus likes to come out between the anterior and middle scalene. And so loosening up the neck can help. But then it runs underneath. Then it runs underneath the collarbone right here before it goes down the arm. And the collarbone can actually get pushed down onto the ribs and actually pinch it right there. It can also actually just get pinched underneath the pec minor. But so things that depress the scapula would pull down the collarbone. And so loosening up muscles that depress the scapula would be a really good idea. And luckily you guys are studying anatomy, so you can name muscles that depress the scapula. Can anybody name a muscle that can depress the scapula? Pull it down. No, with all due respect, rhomboids would actually elevate and retract the scapula because they run up. Latissimus dorsi. Hold on. I've got to mute somebody here. Latissimus dorsi does pull down the scapula, I'll give you that. It really pulls down the arm, but it is a down pulling muscle. It's not a bad guess. Wouldn't be my first place to go. What? Sorry, go ahead.
About the lower fibers of the trapezius, and I don't know if I'm wrong about this, but the serratus anterior.
Lower fibers of trapezius, definitely right, they pull down. Serratus anterior does, it pulls down and forward. So it would count as a down muscle. What else do you suppose might pull down?
Pec minor.
Oh yeah, I should have thought of pec minor definitely pulls down. It works with the serratus anterior. So we would work in this area a lot to loosen this up. And I love your lower trap idea too. Good. Those are big things we'd work on. And those could really help. So we hit the scalenes, pec minor, those two things like for sure. Serratus anterior, not a bad idea at all. And lower traps, not a bad idea. And by the way, latissimus dorsi was not a bad idea. It does pull down. It's not a crazy thing. It just wouldn't be my first pick. Yeah, good. And that's thoracic outlet syndrome, right? It is a syndrome of this outlet, this nerve coming from the thoracic region that feeds the arm. And she listed off 3 types. I've never heard it divided up that way. It's very correct what she said, by the way. I just never think of it that way. Because it can affect the neuromuscular bundle there. Please let me explain what a neuromuscular bundle is because you have them all over your body. Your body, just like a clever road crew, if it's going to run a nerve down through here, right, through a hole down here, it figures it might as well run an artery down with it, and it might as well run a vein down with it. Because why wouldn't you? When they put sewer lines underneath the road, they also run the water lines under there with them, and if there's power lines around there, you might as well run them through the same place. And that's a neuromuscular bundle. It's a bundle of nerves and arteries and veins that run together, or a neurovascular bundle. And they run through here. And so, by the way, if the nerve gets pinched, you kind of get some tingling down here, right? Or lack of sensation or achiness or whatever. If the artery and vein get pinched, you might get coldness down here. You're not getting enough blood down here. You ever have that in the morning where your hands feel cold and achy and stuff like that? Part of that's just because your body's shut down blood to them. You don't need as much then. But that's kind of what's happening in a way. It does not mean you have thoracic outlet syndrome, but my point is it's a similar concept. So that's a neurovascular bundle or a neuromuscular bundle. It's the nerves and the stuff that feeds the muscle all running together, and any of those can be pinched. And what's very interesting that Ms. Hunter said, she said it's very unusual for the artery to get pinched. It's much more common for the vein to get pinched, and there's a reason for that. Arteries are under higher pressure. They're harder to pinch. Veins are under low pressure. They're coming back. We're going to learn that later when we do the cardiovascular system. Let me ask you this question, everybody. Can thoracic outlet syndrome also be a double crush situation?
No, because you're shaking your head no?
No, I was waiting for some. I'm sorry, I was looking through my pictures for somebody to answer.
Okay, well, I was gonna say yes. So, but then you started shaking your head.
Sorry.
no, and then I was like,
Sorry, no, I was like, nobody's going to answer this. Yes, it can be a double crush syndrome. It can get crushed here at the scalenes. It can get crushed here underneath the rib and the clavicle. It can get crushed by the pec minor here. It could be crushed down here, and it's making the symptoms here. So it could be any of this stuff along here. It could be double crush, triple crush, all sorts of stuff. That would not be uncommon too, because when the nerve gets pinched here, it creates some pain, which causes all this other stuff to tighten up. Think about it. When your shoulder hurts, you kind of lock it down unconsciously. Well, locking it down makes the problem worse. Now I'm crushing it here too. So double crush definitely can apply to thoracic outlet syndrome. I assume it's going on when I see thoracic outlet syndrome. I don't know for a fact, but I work it as though there's double crush, triple crush, quadruple crush. Crushes everywhere. And Ms. Hunter, by the way, thank you. I like the visuals. You crushed it. That was awesome. Very awesome. Okay, Mr. Kandaris. Mr. Kandaris is going to tell us about trigeminal neuralgia.
Alright. So, trigeminal neuralgia is a neurological condition where basically it's an excruciating amount of pain on this specific nerve, the trigeminal nerve?
Yeah, trigeminal nerve.
Alright. And it can affect one or all three of the nerve branches in
Where-
that area.
Where is that nerve, roughly?
Well, I'm getting there.
Okay.
And it is in the face.
Thank
so
you.
basically, pain gets caused in the area by basically just any contact with the face. So it's like whether you're just touching your face or shaving or drinking something or even talking. And the levels tend to get worse. Like, as time goes on, or B, just depending on the case, like, each person can experience more pain or less pain, But yeah, this just seems pretty bad, and actually, it says that the pain can be so bad in people's face that they are actually begging to be killed.
He's right about that. It's supposed to be just the worst thing in the world.
Yeah, so that sounds awful, but it's a pretty rare case, thankfully. It only affects less than 200,000 people a year, and or 1 in every 15,000 is like the statistic. And it does get misdiagnosed a lot, and it is more common in females than in males, and typically older population, so 50 or older.
Can you massage?
Oh yeah, so I didn't find anything specifically, but I'm gonna go with that. It would make your face a contraindication. You can massage someone, just don't touch their face.
Yeah. I don't think you'll ever, from what I've heard described about this, I don't think you'll ever even have to kind of come across this while somebody's having a flare-up, so to speak. By the way, some people get this. Really simply put, by the way, it's pain in this nerve. It's called the trigeminal nerve. And trigeminal means like, tri means 3, and geminal actually means twins. So it's like thrice twinned. It's a nerve that splits out in 3 ways, and you've got it on both sides of your head, and that's where it got the name from. But it's a face nerve, and it kind of goes to, by the way, it goes to your mouth and your eyes and some of your face stuff. And mouth pain is very, very painful. And people who have had it say it is absolutely, when it's really bad, it makes a migraine look like a picnic. It's really, really bad. They don't know what causes it. Some people it happens once or twice and never happens again. They just don't know anything about this. You're not. I don't think you're ever going to have somebody show up and actually have it hurt while they're going through that. But if it felt good, you could rub it. There's nothing to say you can't. There's no real studies on whether massage helps us or not. I don't think you have anything to worry about. There doesn't seem to be any contraindication for it for anything. They don't know what does it. I doubt they're going to want you to touch their face though, because they claim that while it's going on, even when it's mild, that like any touching to their face is very, very painful. I just don't think you're going to have a client ever come in this situation.
My mom actually just had a guy had it a few
Yeah?
days ago.
Yeah?
Yeah, and it was the doctor who delivers babies, not the pediatrician, but the other guy.
Okay, obstetrician?
Yeah, that guy. She said that he had TN. Also, yeah, the abbreviation is TN.
Got it, cool. But he wasn't actively feeling it while he came to her. No. Yeah, no, some people have it once in their lifetime and that's it. Yeah, I don't know if he was regular or not, but yeah, it's very interesting.
So she had another guy in the past who went through surgery for it, and not much really happened.
Yeah. Any questions? I hate to say this, but I should just tell you the truth. I can't answer a lot of questions about this. I've never knowingly had a client with this. I've never done anything more than read about this. I mean, I know where the trigeminal nerve is, and I understand what it feeds, and I've read about how painful it is, but everything I know is that they just don't know what causes this at all, and that there's no concern when it comes to massage.
I have a question, but it has nothing to do with this. Well,
Okay.
It does have something to do with this.
Sure.
I think this is the second time today that I've heard that some crazy, painful, oh yes, it was the migraine, and then this is like affect women more than men. Is this like a common thing? For like most diseases or many of them to affect women more than men?
Well, I don't know if I'm qualified to answer that. There are definitely diseases, by the way, that only affect men. Or not only affect men, but more commonly affect men. I've got one. Has anybody ever noticed that my pinky's always down like this?
No.
Oh, well, this is called a Dupuytren's neuroma, and it's a shortening of the tendon here, and I literally can't straighten my finger up. And it affects middle-aged men, middle-aged white men, by the way, about like 95% of the time. It affects everybody in the world. It can affect women. It can affect black people, but 95% of the time, it's middle-aged like white guys that get it. And so it's one of those situations that we don't know why, but it really seems to affect men. So there are things that, and it's a shortening of the fascia in that area. Some people, you'll get clients with this where it's really bad and they're like this. And it's not arthritis. All that stuff. And it usually, by the way, is around your ring finger and pinky. And I've got it in both hands just a little bit. What?
Is it painful?
It is a little painful when I try to stretch it. And I'm always trying to stretch it because I'm like, it's soft tissue. I should be able to stretch this thing out. And there are some treatments for it. I just haven't chosen to do them yet because I don't like messing with my hands if I don't have to. And it's not painful like right now. I feel no pain. It's painful when I stretch it. Yeah. But anyway, I was just trying to give you an example of a disease that does not affect women hardly ever. It does, but it's very rare. But you're right. There does seem you women got it tough. You know.
Yeah, we do.
Yeah, you got it tough.
I don't know if it makes.
Yeah, go ahead.
Go ahead.
Nope, go ahead.
I don't know if it makes her feel better, but the book did say that herniated disc was more common in men.
Yes.
So, I know that one's not a real horrible one.
By the way, we think that's for two reasons. Well, it's probably for three reasons, but for two reasons, men tend to be heavier, and that's what herniates discs. And we tend to carry our weight in front in our stomach, which puts a lot of pressure on the low back. So not only are we heavier, but we're heavier in a particular type of way. I think the third reason is guys just do lots of stupid stuff. But anyway, lift things they shouldn't lift. But that's just me. But it's much more common for men. You're right. Herniated discs are, yes. Herniations in general are more common for men. Yeah.
So the thing you're saying with your pinky, I don't know if it was in our class that I heard this, but someone was saying, and I don't know, maybe I heard it from class, I don't know, but when they drink red wine, it was a male, they drink red wine, time that their hands would like crimp up like this, and then you'd have to massage them out. I don't know.
That to me sounds like an allergic reaction that's affecting their nerves or something. Yeah. Because I'm convinced red wine helps my hands. It definitely makes me better looking. Yeah, I don't know. I've not heard. That sounds like an allergic reaction. It really does. And that it's affecting their nerves and they have to kind of.
I don't know where I heard that or who was telling
Yeah.
me that.
I don't know. I don't know. It's interesting. I don't know anything about it. Yeah. By the way, can you all see the thing I shared? I just want to show you a picture of the trigeminal nerve. Kind of gives you an idea of all the places it goes to. Yeah. All right. So I think I'm supposed to do a presentation too, correct? All right. It better be good, huh? Okay. I would like to talk to you about carpal tunnel syndrome. So carpal tunnel syndrome, kind of like thoracic outlet syndrome, is an impingement of nerves or arteries or veins, that neurovascular bundle we talked about, right? It doesn't just happen out of here, it goes all the way down. And there is a tunnel in your wrist. Carpal means wrist. We're later going to learn about the carpal bones. There's 8 carpal bones in here. They're wrist bones. And in my wrist right here, there is a ligament that goes across. Some people call it the transverse carpal ligament. Yep. And I call it the flexor retinaculum. By the way, other people do too. But as a massage therapist, we call it flexor retinaculum. Anybody remember what retinaculum was?
Like the tight bands of fascia. Well, I'm not necessarily tight, but the bands.
Yeah,
bracelets.
it's fascia that is in a ribbon-like. And quite honestly, your body's really smart, and it's got fascia wrapped around your wrists, just like somebody doing gymnastics wraps their wrists to protect them. But what this does is my carpal bones are underneath here, and they're kind of curved, and this makes a tunnel under here. And this, I'm doing a terrible job here, this is the carpal tunnel. It's created by my bones underneath and the flexor retinaculum on top. And this flexor retinaculum is actually really important because what it does is all my other tendons run underneath it. It kind of acts like a pulley because most of the muscles that I'm using to do this are not in my hand. They're down in my forearm. Like if you move your hand, you'll see your forearm move. Most of the power is coming from here and it's running underneath here. Anyway, if this area gets inflamed, it pinches down on the nerve there. And it generally pinches down on the median nerve, but it doesn't matter. It's a nerve that kind of goes over here to your thumb and stuff. You'll even see the thumb actually over time atrophy because if this goes on a long time, this thumb gets no impulse and people stop using their thumb, and most of the meat of your thumb is muscle. So the symptoms are things like weakness in their hand and things like that. A lot of stuff you feel in the morning, they're feeling all the time. And that's carpal tunnel syndrome. Everybody has a carpal tunnel. This is carpal tunnel syndrome. Yeah? So, here's a picture of somebody who's had it a long time, and their thumb pads, which are called your thenar eminences. Your thenar eminence, by the way, this is your pinky pad is called your hypothenar eminence, underneath your thenar eminence. But anyway, your thenar eminence, your thumb pad, is made up of, gotta make sure I'm telling you right, 3 muscles basically in your thumb. And that starts to atrophy after a while. If you're not getting nerve impulses to something and you don't use it for a long period of time, it starts to waste away. And so here's a picture of somebody who's had carpal tunnel for a long time. And so the thumb muscles that make up the thenar eminence are starting to waste away a little bit. Anyway, that's what it can do. By the way, does anybody remember what word is always found in any muscle that goes to the thumb? Good.
Is it pollic?
Oh, that was close enough. I'm really happy. Polysis.
Oh, okay.
Pollicis with a P, which is what you said, pretty darn close. There are 8 thumb muscles, and all 8 have the word pollicis in them. So it is a good word to know. There are 7 big toe muscles, and all of them have the word hallucis in them with an H. Anyway, moving right along. One of the things that they sometimes do to treat carpal tunnel syndrome is they actually go into the wrist and cut the flexor retinaculum. It's the top of the... It's what?
That looks scary.
Yeah, it looks scary to me too. I've got a video on it. You want to see the video? No? Because it's scary. I've got it right here in the slideshow for you guys if you want it. They cut the flexor retinaculum, which relieves the pressure in the tunnel. And later what happens is it grows back some scar tissue over the top. And that's one of the ways they treat carpal tunnel, is they cut that. I realize I'm not a doctor, but I would not recommend this surgery except as a last resort. There's a lot of times it doesn't work very well. Because what happens is they cut the flexor retinaculum. That works wonders right away, right? It makes space in here, but it grows back scar tissue later. It has to. And the scar tissue then sometimes pinches on the carpal tunnel, or the nerve in there as well, and makes the carpal tunnel clogged up again. And so it often creates problems again. And the person, honestly, 6 months later, they're like, well, you need a second surgery. And they want to do the same thing again. It's just, it's very, I don't know. Here's the other thing that can happen. And you would think that doctors would catch this, but sometimes they don't. Could carpal tunnel be thoracic outlet syndrome that's being misdiagnosed? Yeah. Yeah. Now, they go into my wrist, maybe they do an MRI, and they're like, well, we see some pinching in there. Good, but I hope you checked up here too and here, because if I got pinching here and here and a little bit of pinching here, it's going to show up as a lot of pinching down here. Think about that for a second. If one cell tower is kind of working okay, and the next one it talks to is kind of working okay, and the next one it's talking to is kind of working okay, the phone call at the end sucks, right? So I might have a little bit of irritation in my carpal tunnel, and the surgeon's like, yeah, we should operate. That's definitely what it is. But I also might have had some stress pinching right here that would have been alleviated with massage. And once you fix this, this might not be a problem anymore. So you might have not only done a surgery that you're going to have to repeat, but a surgery that probably didn't need to be done because it wasn't the whole problem, because I had double crush or triple crush syndrome. I had thoracic outlet syndrome. So be careful. With everybody, by the way, when you go to a massage therapist, they're convinced that they can fix all your problems with massage, right? You're like, I got a headache. I'm like, massage will help that. My house is on fire. Massage will probably help that, right? Surgeons do the same thing. It's not even their fault. You know, they have a hammer, and so the whole world looks like a nail. And so they're always like, we can cut that out. But that's not always the best approach to go at all. So let's talk about massage will help. If your house is on fire, it will help? Yeah. I mean, why not? Right?
It will, because it will help you be less stressed, because there's nothing you can do about your house being on fire.
Well, I realize I am biased, but I hope that you guys realized how many of these diseases that even strict medical information out there says are stress-induced. I would argue, because of people not being in the parasympathetic state, that basically every disease is stress-induced, and therefore massage helps everything. Everything. And I'm sure there's something that doesn't help out there, but everything. I would argue that massage is more likely to help everything than surgery is. You know, especially if you do it ahead of time. So I would argue that's, you know, it's like a good diet. You can't argue that it's not helping everything. Yeah, so I'm with you, Miss Hunter. I like where you're going with that. Yep. House on fire, get a massage. You guys don't...
I have some questions.
Please, what's your question?
Oh yeah, but in my son, he have in the nervous under clavicle, and so in the block in the run to in the arm, and very slowly, and so he have the feeling very weak in the that, and so and I need to in the celery in the take in the nerve up in the ow, but in the what happened when in the massage?
Yeah, you should. So he's getting weakness in his hand. Here's the problem: is one of the common symptoms of carpal tunnel is weakness in the hand, weakness and numbness in the hand, because the nerve's being pinched.
Yeah.
But you can get weakness and numbness in the hand if the nerve's getting pinched up here too. And you can get weakness and numbness in the hand if the nerve's getting pinched here too. So I say massage all that first. Yeah, under the clavicle. Open all that up, get the clavicle up.
Yeah.
Yeah.
Thank you, sir.
So what is the difference again between a thoracic
Can you
outlet
prevent
syndrome?
carpal tunnel?
Hold on one second. We'll talk about that, Ms. Torres. Ms. Monreal, what's the difference between what?
The thoracic outlet syndrome and the shoulder impingement syndrome.
Shoulder and...
I mean, I know that there's, we talked about it.
You mean frozen shoulder?
Yeah, but there's a shoulder impingement syndrome. We didn't go over that in our pathologies, so never mind, I guess. But
by the way,
frozen shoulder also.
My quick answer: frozen shoulder is usually the soft tissue in that area actually kind of hardening up and locking down around the shoulder. Sometimes that even has to be broken free, but you can work on it with massage. But I suspect what you're talking about is just a different nerve being pinched. Thoracic outlet syndrome is so common they've given it a name, but really it could be called pinched nerve syndrome. This could be called carpal tunnel, could be called pinched nerve syndrome. Pinched nerve syndrome in my wrist, pinched nerve syndrome in my neck, pinched nerve syndrome in my chest, pinched nerve syndrome in my elbow. Some people call this cubital tunnel. Yeah, the fact is, though, those nerves can be pinched in multiple places, which is why I don't care what you call it. Think of double, triple crush. Yeah.
Okay.
So, Ms. Torres, you asked if there are things you can do to prevent it. We do think stretching your hands out before massage helps, especially getting your thumb and fingers completely open. You can put them up on a wall and get them to all stretch out because it opens up the carpal tunnel. And I'm going to show you that with massage here too. You can actually, so when somebody comes to you with carpal tunnel syndromes, are you going to massage their neck? Yes, Mr. Tapscott, I'm definitely going to massage their neck because they might have thoracic outlet syndrome too. I'm just going to work that whole nerve. Are you going to massage their chest and stuff like that? Yes, absolutely. Are we going to massage around their elbow where the median nerve's going? Yes, I'm going to do that. And then we're going to address their wrist though too. The flexor retinaculum attaches to my thumb and pinky. Which means if I roll the thumb and pinky out, I can stretch the flexor retinaculum. What? Yeah, I don't actually have to take a scalpel and cut it open. I can stretch it out and create more space in here by just rolling those things out. Kind of like this person's doing the picture, although you'd be doing it a lot harder than that. But they're opening that area up. I'm not trying to rub right in the wrist. This is annoying. That's actually a contraindicated area right there. But out here, open this thing up. Flexor retinaculum, open it up, yeah. Open the hand up. So open the neck up, open the chest up, open the elbow up, open the wrist up. Think about it. If they've got pinching in all those areas, which is not that uncommon, and you make this just 10% better, and this 10% better, and this 10% better, and this 10% better, that 40% might be enough to make it go away.
I've had problems with this before, and definitely I've had it worked on, and it gets better, and it did take a few times. But it's just something that I kind of have to keep up on, like, I don't know, once every 6 months, where I just have like 1 hour on each hand.
Beautiful. I love what you just said,
and
though.
Not just the hand, but all the areas that you just said.
Yeah, I love what you just said, though. So you get carpal tunnel symptoms, and massage takes them away.
Yeah.
Yeah. And you get all those areas worked and stuff like that. Here's the beauty of massage, by the way. Now, when you tell this to somebody, don't tell them I can cure your carpal tunnel, because maybe you can't. And we don't even know if they have carpal tunnel. But what I tell them is massage often helps the thing that you seem to have going on. And I can explain to them, you could have a pinched nerve anywhere down here, and we kind of open up all those areas. And they'll say, can you guarantee it'll work? And I always say, absolutely not. but I can guarantee at the end of a few sessions, you'll know if it's helping or not, and you'll only be down a couple $100 before you go get cut into. With a surgery that you'll probably have to repeat again. And by the way, the reason they don't repeat it a third time is by then they finally give up. There's a lot of doctors out there now recommending against carpal tunnel surgery because it works wonders for a couple of months. It's instant relief for a couple of months, but then it comes back, you know? And I think Miss Monreal is living proof that every 6 months, she kind of has somebody work her over really good on this stuff, and she's okay. Yeah. So again, another tension, stress-induced kind of syndrome, really. Yeah. Cool. Okay. Oh, I even put a massage protocol in here for you guys. Wow, I'm good. Okay. So what I would do with somebody who has carpal tunnel or carpal tunnel symptoms or whatever is I would massage their forearm flexors and extensors, right? They're flexors because they kind of pass through the carpal tunnel here, right? Why would I do their extensors too? They don't pass through the tunnel, so why would I do that?
I don't know if it would like maybe support the other muscles that move the hand or the arm.
Sure.
Or whatever.
And could these be an antagonist of this agonist?
Yes.
Yep. Just they could argue together. So you're absolutely right. It could be a sport thing too, Miss Monreal. But the fact is, I don't like if I'm going to loosen these up. I'm definitely going to loosen up these in back too. Good. I would carefully massage around the medial and anterior elbow, which is your humeral ulnar joint, because the nerve passes through here. Right? I would massage the arm, just because the nerve's going through here. I would massage pectoralis minor and scalenes, right? Why pectoralis minor and scalenes? You guys already told me, but why?
Because that can be pinched as well.
Yes, and they could be pulling down, yeah, they could be pulling down the collarbone, right? The clavicle too.
Yeah.
And pinching under here. Now we're getting to thoracic outlet syndrome, right? But the thoracic plexus turns into the median nerve. That's just it named something different when it gets down there as it gets smaller. I would massage the hand. I would roll the thenar eminence out laterally and roll the hypothenar eminence out laterally at the same time, externally rotating them both. Why am I doing that?
To stretch out the retinaculum around the wrist.
Yes. Cool. And I just said here what I already said. Carpal tunnel may be a combination of thoracic outlet syndrome and cubital impingement, which means your elbow. So you can have all three. And am I going to diagnose those? No. I don't actually have the mental ability to do it, the training to do it, or the equipment to do it. But I don't need to do it. Nobody's going to mind me massaging their neck. Everybody loves their neck massage. Their chest, everybody loves their chest massage. And their arm down to their wrist. If they get better, they get better.
Correct.
What?
Is that correct? We're not supposed to diagnose either, right? We can have our thoughts, but we can't diagnose.
Right. Yeah. You are not legally allowed to diagnose. And with all due respect, I don't think any of us is qualified to diagnose. But I can, yeah, go ahead.
I was just saying, just so we know that we can't say, oh, I think you have shoulder impingement syndrome. Like if they come in and they say that their doctor or whatever they have it, that's something different. But we can't say, oh, you have whatever, right?
Yeah. Don't ever say, oh, you have whatever. Don't ever say that. You're right.
Well, yeah. You know what I mean.
No, I know. I wasn't even trying to be funny. I meant don't ever say you have thoracic outlet syndrome. Don't say that. Okay. I do tell people when they say, why are you working such and such? I go, well, I'm not qualified to diagnose you, but I'm operating off the fact that you might have a pinched nerve here, 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 or here, and that's called thoracic outlet syndrome, cubital impingement, or carpal tunnel. And I'm just going to work all those because it could be any of those. And by the way, to be very honest with you, it could be other things, but that's a pretty good guess just based on my experience. But I'm not qualified to diagnose. So it's okay to tell them, like, I'm working on this because I think it might be this thing, but I'm always very honest, like, but I don't know, you know? They actually, it's funny, but people believe you more when you're honest about what you don't know. Right? Then they believe you when you're like, I'm pretty sure this thing over here is true because I admitted when I didn't know. But yeah, I never tell them for sure you've got this thing. I just say you've got these symptoms, and so I'm wondering if there's a pinched nerve along here and stuff like that, and that's why I'm going to work that. And I know you got your doctor told you carpal tunnel, and I'm sure your doctor's right, but you could also have some pinching of this nerve up here too. I'm never trying to argue with the doctor. Yeah. So you could have assumptions, just don't diagnose. Yeah, and you can even share your assumptions. Like, I'm kind of wondering if you've got this thing going on, but of course I'm not qualified to decide that, but that's what I'm going to work on. That kind of thing. Yeah, and you have to do that in your head, right? You've got to have some idea of why you're doing what you're doing. Like, if you come into me with back problems, I'm going to work on your back, but I might also work on your feet, because maybe your feet are messed up and it's making you stand funny. And if you ask me, why are you working on my feet? I'd be like, well, your feet are the foundation of your body. Maybe they're off too. I don't know, but it's a good place to work on too. Like, you can share that kind of thinking. Does that make sense? Cool. All right, everybody, let's test for nerves right now. And I'll make sure you don't have anything else to do along with that. But anyway, I will do that. I'll put out an announcement about it with links, and I'll do that really, really soon instead of late. And I will look forward to seeing you all on Monday. Okay? Thank you. I'm sorry, I know that was a lot of stuff. Nerves are big. They're big. But again, they're just wires that communicate, that have receptors at the end. And when that receptor gets set off, it sends a signal up to the brain. The brain makes a decision, sometimes sends a signal back and says, hey, do something about that. That's all it is. This is just the communication system of your body. We care as massage therapists because that communication system can get pinched, double crushed, impinged, and that could cause problems too. Yay. All right, everybody. I love you guys. I'll see you later. Okay?
So today